Okay, so today we'll talk about manual lymphatic drainage. And so, manual lymphatic drainage is one of the most important components of complex lymphedema management, and it's really the first step after you cleanse the skin. So, if so you have to really see where the lymphedema actually is. So in this case, let's assume that it's on the right side. So if the right arm is edematous, you don't want to drain um, anything on the right side. So the whole idea is to try to push the lymphatic fluid away from the right and into the unaffected lymph nodes. So what's happening is because of some sort of an obstruction, lymphatic fluid is not able to get to the lymph nodes. So maybe because there are no lymph nodes on the right side, or if there is an obstruction. So what we're going to do is we're going to try to push them away to the unaffected lymph nodes. So what are the unaffected lymph nodes? We have lymph nodes in the cervical spine, right and left, and then lymph nodes in the left axilla, and lymph nodes on the right inguinal region. So the first step would be to prepare these lymph nodes. So I'm going to start with preparing the cervical lymph nodes. And it is, again, the difference between lymphedema massage and regular massage is that this is very superficial. So you're really literally on the skin because the lymphatic vessels are right under the skin. So all you're doing is stretch and release. Stretch and release. Once you stretch, you don't want to then pull back. So you're just going to stretch and leave it right there. So that is preparing the cervical lymph nodes. Now, if I go a little deeper, I would get to the level of muscle, which will mean that I would compress all the lymphatics. So the fluid will remain where it is, and I'm reaching the level of the muscle. And that's why you have to be very careful to be really superficial. So once you prepare the cervical lymph nodes, you do the same for the axillary lymph nodes. So I'm going to stretch and release. Stretch, release. Stretch and release. For the sake of time, I'm not going to do this for the number of repetitions that's supposed to be done. But the idea is to prepare the cervical, prepare the unaffected lymph node, and then prepare the inguinal lymph node. After this, the other difference between manual lymphatic drainage and regular massage is that it does not follow the distal to proximal rule. So you don't go distal to proximal. You will first clear the proximal. Because if the upper arm is, if there is obstruction here, no matter how much you try to move the fluid upwards, it's not going to go anywhere unless you have this upper proximal part cleared. So you'll first start with the upper extremity, so the proximal part. So what I'm going to do is I'm going to start with the, let's see. So I'm going to move the fluid over to the left axillary lymph nodes. So the movement really is like a windshield wiper. Stretch, 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 stretch. The other way you could do it is called a rotary. So you rotate and go forward. Once you've done this, you come to the shoulder. What I like to do is I'm gonna have the patient's arm rested on my thigh. So now I'm going to first move all the fluid from medial to lateral. Once I do that, then I'm going to move this up all the way to the cervical lymph nodes. After I do this, I'm going to drain towards the unaffected right inguinal lymph node. Once I do that, I'm going to go both directions, down and across, down and across. End it there. Then I'll start again at the arm. Do another round of this. Go down now to the elbow and forearm. So here I can use both hands because I have more room. And all I'm doing is, again, doing two things. I'm first trying to move the fluid dorsally, both ways. And then from the hand that's behind, we try to move it upwards towards the elbow. Once it's at the elbow, and move this. And now drain again. Finish here. Then you're going to start the same thing at the fingers. And so you stretch. Make sure that once you do this stroke, you don't want to come back. So keep going in one direction. And then you follow the same thing. Go up to the elbow. See right there. And then do the same thing again. Go across and downwards. Now I'll ask the patient to go into prone. across. And you can either do it this way, where you're going straight, or you could have your hands side by side. All right, so this session should actually take somewhere from 45 minutes to sometimes an hour, but for the sake of time, we've shortened it. So this is the whole purpose, is to try to drain the fluid, as I said, across to the unaffected lymph nodes. And yeah.